If you're planning on taking the OET reading test in 2025, it's crucial that you have a solid strategy in place. With its strict time limits and variety of text and question types, many candidates find this to be the most difficult part of the OET exam. But with the right strategies in place, you'll be able to master this test with confidence. In this video, I'll break down the key techniques that you need to help you navigate the exam, boost your reading speed, and answer even the trickiest questions. Let's get started by talking about exactly what the OET reading test is. This test is designed to assess your ability to manage different texts from healthcare environments. This test is not profession specific, meaning that doctors, nurses, pharmacists, and all professions will take exactly the same exam. The test lasts for 60 minutes and is divided into 3 sections, each with their own texts, questions, and strategies required. It's crucial that you know how to manage your time and answer each specific question type so that you can give yourself the best possible chance of getting a high score. Let's go through each section of the exam now, starting with Part A. In Part A, you will read 4 texts and answer 20 questions in 15 minutes. This isn't a lot of time, so it's really important that you know the right reading strategies to use in order to finish and answer all of the questions. All of the 4 texts are related to the same medical topic, and the questions are designed to get you reading through the text quickly in order to identify specific details and information. Let's look at an example of a Part A section now. So here you can see 2 texts from a Part A reading test. We have text A and text B. You can see that these texts have different styles. So text B is a table and text A has bullet points and short paragraphs with headings. And here are text C and D. You can see that they're on the same topic as before, and text C also has a table style, whereas text D has a little paragraph at the beginning, a table, and then some bullet points. So you can expect all of the 4 texts to be this kind of style, a variety of tables, maybe even diagrams or flowcharts, bullet points, and short paragraphs. Now let's take a look at the questions that you will be required to answer. In Part A, there are 3 question types. The first set of questions are always matching. This requires you to match information to specific text, either A, B, C, or D. And in order to answer these correctly, it's important that you begin the exam by skimming all 4 texts, as this will give you an idea of the content of each one. So let's take a look at some matching questions now. The matching questions are usually questions 1 to 7 or 1 to 8, and you can see that it asks you in which text can you find information about, and then for each question, you're going to match the information to the particular text. The next question type will be either short answer or gap fill. So there'll be about 7 or 8 of each question type. In this exam, the next set of questions are short answer. So let's take a look at those. In this section of the text, you are simply going to answer each question with words, numbers, or both. For this part of the test, it's important that you don't write too much information. The idea is to directly copy a word or short phrase from the text in order to answer the question. These questions are going to require slightly more detailed understanding of the text in order to answer them correctly. Now let's take a look at the next set of questions, which are gap fill. For these question types, you have to complete each sentence with a word or short phrase. Again, it needs to be copied from one of the texts. So you need to include words or numbers or even both. But the important thing to take note of here is that your answers must be grammatically correct in the sentence. So the first thing you should do is read the sentence and predict what type of word is missing. Is it a noun, a verb, an adjective, or a short phrase? You then need to go to the text, find the answer, and make sure that the answer you write in each gap fits grammatically in the sentence. So that is part A of the reading test, and for this section of the exam, it is important that you have got a good reading speed, you're able to skim and scan appropriately in order to find those answers efficiently. Now let's move on and talk about part B. which consists of 6 short texts, each accompanied by a multiple choice question. All you have to do is read the text and select one correct option from the answer options provided. Let's take a look at an example Part B question now. So first you will see the question with your 3 answer options, and then you will have your text. The type of text that you see in this part of the exam may be medical guidelines, instructions, or extracts from an email. You can see here that the type of question that you've got to do, you will need to have a detailed understanding of the text, so you will read through, understand it, and then go through the answer options, eliminating the incorrect ones until you choose one that's correct. It's recommended that you spend about 10 to 12 minutes on the Part B texts and questions, as this will then allow you more time for the more challenging Part C. Let's talk about Part C now. In this section of the exam, you're going to read 2 longer texts of around 700 to 800 words each. Each text comes with 8 multiple choice questions. So as with Part B, it's a multiple choice task, but in Part C of the reading test, you have 4 answer options. It is a lot more challenging because the texts are longer, more complex, a bit more academic in nature. So you're going to be tested on your ability to understand complex vocabulary and also infer the attitude or the opinion of the writer. Let's take a look at an example Part C question. Here you can see the first 3 paragraphs from a Part C text. As you can see, it's a lot more dense, there's a lot more information in there, and it is more complex. So this is just a small section of a larger text that you'll be expected to read. And now let's look at some example questions that will come with the text. So as you can see, they're multiple choice questions with 4 possible answers. The questions usually indicate which paragraph you'll find the answer in. As you can see here in question number 1, it says in the first paragraph. So you know that the answer will be found in the first paragraph. And likewise with question number 2, it says in the second paragraph. It usually is clear, either in the question or from the context, which paragraph the answers can be found in. So this will really help you to locate the answers much more efficiently. Now let's talk a little bit about Part C, because many candidates do find that this is the more challenging part of the exam. And the reason for that is that you are expected to identify and understand complex arguments and ideas, and identify and sometimes even infer an opinion or attitude from the writer. So let's talk about essential strategies that you should use for Part C of the reading exam. First is the ability to identify opinions. If you have a question that's asking about the writer's opinion, you'll want to look out for particular phrases and words that indicate an opinion. For example, words such as controversial or beneficial, or modal verbs such as can, could, may, or might. These types of words are often used to signal that an opinion is coming. So practice reading text and asking yourself, what is the writer's opinion? How do I know what their opinion is? What language helped me identify this? The next thing you'll need to be able to do for Part C is to recognize referencing. Some questions are going to ask you what particular words or phrases are referring to. For example, words like this, that, or it. You need to be able to identify exactly what information in the text these reference words refer to. In order to do this, you need to read the sentences around the reference word. Read backwards and forwards in the sentence to help you get a good understanding of what that reference is about. Another strategy that will help you in Part C is the ability to infer meaning from context. In some cases, you might see unfamiliar vocabulary that you don't understand. You need to be able to ask yourself what the word could mean based on the context of the sentence or the paragraph. Practice reading text in your own time. Identify words that you don't know. Use the context to ask yourself, what might this word mean? And then see how that helps you understand the text as a whole. Now let's look at some preparation strategies you can use while preparing for the OET reading test. In order to maximize your chances of success, it's essential that you follow a structured plan. So here is what we at Swedish English recommend. First, you should familiarize yourself with the exam format. This means understanding exactly what you will see in the exam and what's expected of you. Make sure you know exactly what type of texts you're going to read, what type of questions and tasks there will be for each part of the exam, and which strategies you're going to use and at what point. This is going to help you walk into the exam with confidence because you'll know exactly what to expect. Step 2 is to identify your strengths and areas for improvement. You can do this by taking an exam readiness test from an OET provider like Swoosh English. In that test, you will simulate the real OET exam environment and take a full reading exam and then see your score. You'll be able to see which areas you did well in and other areas that are going to need a bit more work. From here, you'll know exactly how much preparation is needed until you are ready to book your exam. The next step is to engage in extensive reading practice. This means not only practicing with OET mock tests, but also reading as much as possible in your spare time. In general, I recommend reading things that interest you. However, in order to fully prepare for the OET exam, I also recommend reading medical journals, reviews, and articles, as these are going to get you familiar with the type of language and vocabulary you can expect to see in the exam. Regular reading of diverse materials will help you build the skills you need to succeed in the test. The next step is to seek help and guidance from expert OET teachers. This is an essential part of the process as it's going to help you build your skills and learn the essential exam strategies that you need in the reading exam. For example, a teacher can show you how to skim and scan a text in order to manage your time effectively. They can also give you tips on how to infer meaning, an opinion and attitude, and they'll of course also be able to go through all of your mock test results with you and help you identify where you went wrong and how you can improve next time. Having expert guidance will help you speed up your exam preparation and build confidence. The final step of the process is to take regular mock tests. This is where you simulate the exam environment and time yourself taking a full OET mock exam. This is going to help you improve your time management, reading speed, and get you confident for exam day. So please don't skip this part of the process. It's very important you do plenty of practice before the real exam. Also, make sure you don't book your exam until you're getting the scores you need in those mock tests. So do lots of practice, and when you're getting the scores you need, that's a good indicator that you're ready to take the exam. Let's finish by summing up everything we've talked about with our OET reading checklist. Use this checklist to ensure that you are preparing properly for your exam. Number 1, familiarize yourself with the exam format. Understand exactly what's required of you. Number 2, diagnose your current level by taking an exam readiness test. Use this to identify areas that you need to work on. Step number 3, engage in a variety of reading practice. Try to do this consistently so you can build your skills and confidence. Number 4, get help from an expert teacher who can help you refine your skills and ensure that you are on the right track. Number 5, take regular mock tests and don't book that exam until you're getting the scores you need. By following the steps outlined in this video, you'll not only boost your confidence for the exam, but you'll also set yourself up well for your professional career in the healthcare field because you'll be able to cope with a variety of medical texts that you see every day. Now, if you're currently feeling a bit unsure about your OET preparation and you're in need of some expert support and guidance, then why not book a free consultation call with one of our student success team members today? In that call, they'll give you personalized feedback on your current strengths and weaknesses, help you look at your study plan and see where it could be more effective for you, and give you an idea of how Swoosh English can help you pass your exam at least 3 times faster. So if you're looking to remove the doubts and get some more clarity in your OET preparation journey, all you have to do is click on the link in the description below this video and sign up for that free consultation call today.